In collaboration with the Emergency Department and Ambulatory Surgery Unit at Women and Children's Hospital of Buffalo, the quality improvement project selected is to decrease the amount of pharmacy callbacks to the emergency department and to the ASU by improving data input of patient pharmacies. As of March 27, 2016, New York State has mandated that all providers prescribe medications electronically rather than on paper, with very few exceptions. The new mandate, which in theory was set in place to help reduce the amount of legal prescriptions, has come with glitches. There's been an increased amount of electronic prescriptions that were inaccurate and resulted in serious time delays for patients as pharmacists needed to contact providers to clarify wrong information. In conjunction with advisors Dominique Guerra and Jeremy Killian, the need for change in the process of data input entry of outpatient pharmacy was recommended. The aim of this project is to decrease the amount of pharmacy callbacks to the emergency department and ASU by improving data input of patient pharmacies, thereby decreasing delays in outpatient care and delays in medication start times. This will occur by May 1st, 2017 for the initial change and May 7th, 2017 for the first PDSA cycle with revisions. The process that was identified as needed improvement was inputting outpatient pharmacy data. The system that was in use in the ED and ASU relied upon an interface that was fragmented, not readily up to date, and did not include information that was vital to ensuring accuracy when inputting outpatient pharmacy data. The current patient population is diverse at Women and Children's Hospital. There are many refugees that come into our hospital. Many do not speak English as their primary language and have low levels of education. Due to these factors, many times they do not know the correct addresses of their preferred pharmacy, and many use cross streets to identify where they are located and give the wrong city of distinction. As the number of e-prescriptions transmitted to pharmacies increases because of legislative mandates, it's essential that technology supporting e-prescriptions is redesigned to facilitate pharmacy workflow processes that prevent unintended increase in medication errors, user frustration, and stress. The current system in place lacks information such as cross streets and 24-hour distinction. These were ranked as highly important on the pre-survey questionnaires. Unfortunately, the interfaces and data that is already in use cannot be updated by IT without incurring a large financial burden. In an effort to improve the system in a more cost-effective manner, a patient pharmacy database handout was developed and implemented in the ED and ASU to improve the accuracy of information that was used in the patient profile. The handout included most chain pharmacies within the Western New York region, with addresses including cross streets, phone numbers, and 24-hour distinction. The current flow of operations includes the RN asking the patient at each visit for the preferred pharmacy. The RN then types the name of the pharmacy in with as much information as they have and waits to see what the database provides in regards to which pharmacies are linked for e-prescription notifications. The current system has numerous flaws. When a pharmacy has multiple locations on a single street and the patient does not know the address, the nurse must close out of the program and use an alternative source, if available, to locate where the pharmacy actually is. With the new handout, the RN is able to easily access the information regarding the patient pharmacies without leaving the patient's electronic medical record. It can be easily updated and is cost effective. It also serves as a hard copy if the system crashes, and now with more restrictions regarding what is allowed to be accessed at work, and enables the RN to obtain information without using internet sources, which are restricted on many of the user profiles. A PDSA cycle was used. Pre- and post-patient pharmacy database handout surveys were given to 40 nurses, and 25 surveys were returned. 10 patient pharmacy database handouts were given in each department. They were given to nurses who ESI triage and do admission histories. After 1 week of use, a post-handout survey was given with 5 questions and space for free text. We predicted that the patient pharmacy database handout would increase the accuracy of inputting patients' pharmacy into their profiles. According to the pre and post handout surveys with free text, 95% of those surveys said the handouts decreased the amount of callbacks from pharmacies and helped to improve the accuracy of the data they input into the patient's profile. The remaining 5% said the handouts were useful when they were around and said that it would be more helpful if IT did their job to update the systems according to need. Based on what we learned, revisions for the next cycle include increasing the amount of handouts in each unit, smaller pocket-sized handouts, weekly surveillance of pharmacy callbacks. We're going to attempt to use a tracker system in each unit. The process of implementing and spreading the change started with the collaborators distributing a pre-handout survey, then distributing the pharma database handout, and finally a post-handout survey. The barriers encountered during this process were lack of participation with pre and post surveys. Initially, the collaborators started out small to try to have a more focused study. However, when no one was participating in the surveys, it was necessary to hand out 40 to get a desired response. This lack of participation was most likely caused by short staffing, high census, and high acuity levels in the ED and ASU. Facilitators that were encountered were having an in-unit pharmacist during the day to help spread the word of the importance of this QI project, and the actual handouts were well received, and the staff asked for additional handouts when they were distributed. Although they were less enthused about having to continue to do the surveys or use surveillance as a tracking measure for callbacks on the next PDSA cycle, their suggestion was to communicate to the collaborators at their leisure as to whether they perceived the handouts to be effective and a positive change. All comments and communication from staff was written down and will be used for the next PDSA cycle. The anticipated impact the change will have on practice is that when the RNs input the patient pharmacy data, it will be 100% accurate, thus reducing a cause for pharmacy callbacks. This will decrease delays in outpatient care and medication administration. It is realized that tracking pharmacy callbacks is an unreliable measure because of the amount of staff that answer the phones. With continued PDSA cycles, the plan is to continue to update the handout, improve tracking and surveillance, and incorporate verbal communication as a measurement along with continued use of surveys.